Welcome, everybody, to another episode of the Collateral Damage Podcast. I'm Mike Wilson, and as always, my friend and co-host Maureen Cavanaugh is joining me here today. Hi, Maureen.
Hey, Mike, how are you?
I'm doing well. I'm pretty excited. I'm always excited, but today especially we've got a very special guest that we're going to get to in a little bit. But the topic for today is the economic impact of substance use on families, communities, cities, counties, states, countries, the world. And I'm interested to hear our guest talk about it, but I'd love to share a little bit about why this is an important topic to us. And as a mom, as a parent, I imagine that there's a toll that it takes on you initially before they even get into treatment, before it's ever a tax on the community, or before it's ever a conversation about where the money should be spent. Big picture, I think the first impact is probably on the family system, right?
Absolutely.
The stealing, the spending, the constantly repairing and picking up the pieces. I mean, do you want to talk a little bit about that? And
You wonder how far to go back. So do I go back to the point where she started to steal and I lost very valuable things? Or do I go to the point where I started to fall apart and couldn't work anymore?
Yeah.
I mean, I worked, I showed up, I sat there, but
Yeah.
I had a very, very good insurance business that I had built up. And I drove it right into the ground because I just wasn't showing up mentally. And I was forgetting things, and I was doing things wrong, and I was not mailing out, premiums and things that I needed to do. And little by little, I lost that ability to make a living. So, and now that certainly wasn't her fault, but it was an economic impact towards me. Then you think about all the money I spent in sober living and treatment, and holy Moses. So I mean, that's on a small scale. So I mean, there's huge economic impact. What about the economic impact of her not contributing to society,
right,
for all the years that she was using?
Sure. I mean, I think back to the stealing, obviously the stuff I stole, stealing from my grandmother, stealing from my family, stealing from my parents, lying to them, manipulating them, the toll it took on them, then the toll it took on the people that they would normally be helping out, like my siblings
Right.
and my other family members and stuff like that.
Right.
And, that my addiction was a black hole. My substance use issue was a black hole. It just took and took and took and took. And I mean, I think it touched them in every possible way financially.
Yeah.
And yeah, it's crazy. And then you expand that. Now it's
Right.
like, well, what about the community? Like you said, they're not
Right.
working, they're not contributing, they're not paying taxes.
Fortunately, we had good insurance, but I know people that went through their retirement. I know somebody that I'm thinking, a person who it's heartbreaking. They went through the equity in their house,
Yeah.
had to move out of their house, and their son passed away about 8 months ago.
Oh,
So,
God,
I
that's
mean,
terrible.
it would be horrible. I mean, all of the things that are missing in my life because of, financially missing in my life because of her addiction. If you gave me a choice to get it all back and have her, of course, I mean, I would give it away twice.
Right.
But they went through all of that and then still lost their son. So, I mean,
Man, that's terrible.
right.
Yeah, I've had a friend of mine, we run a free support group, and we used to do it a little differently years ago, and we'd have people come in and they'd tell their story, and then we'd talk. And I remember my friend came in and he was telling his story at our group, and he was talking about how much money his father has put into his treatment. And, I mean, he got up into the hundreds of thousands. I think it was $500,000. That his family was fortunate enough to have that, and I doubt they had it set aside. It was the just in case drug addiction
course.
hits our family, or just in case treatment is necessary fund. I'm sure they shut down a business or took from their retirement. But such an insane amount of money
Right.
to have to put into this. I mean, there's not a lot of other medical conditions. There's not a lot of other scenarios where when it hits, you need to think about going bankrupt.
No, I
You
don't. I
know,
don't. I
it,
think you're right.
and you shouldn't have to, especially if you have insurance. I mean, if you're dealing
Right.
with this medical condition, like, you should be able to go to the doctor and be like, oh, you have a substance use disorder. And it's like, oh, well, this is the plan, and your insurance should cover it to the end because this is what it's going to take to get you well. Not it's the least that they're willing to do just to help you get over the physical dependence, but they're actually going to try to help you get well. And man, the toll that it takes on families financially is just insane. Houses being
Right.
sold, retirements being drained, college funds
College.
being
Right.
expended. You know, that's
You hear that all the time, the college fund.
yeah,
Yeah.
yeah,
And that's not what they intended to do with the college fund. And yet you hope, in a best possible scenario is that the person gets well, and then they no longer have the college fund. So
right.
then where is that coming from?
Hmm.
People that are, I mean, and that's like a microcosm of what's happening economically.
Oh yeah.
But when we start expanding that and talking about what is happening to the economy in general because of substance use disorder,
Hmm.
that's, I always, I hear from people all the time, and I talk to people all the time. And when I talk, I inevitably get somebody that says, I don't care about these people. It's not my family.
Yeah.
And even if some people, the hardest thing is to hear is when it is the person's family and they've written them off and they don't think we should be spending any money on
Yeah.
them. Okay, so they don't spend their money on them. But they don't seem to understand that the cost of this person being sick
Oh.
is going to impact them regardless of whether they care about this person or not. So if they don't have even a little bit of empathy,
Hmm.
they I'm sure then they may care about their checkbook and what's in their bank account and what's getting taken out in taxes, because it's coming from somewhere.
Well, I mean, who looks at it like that? You know, I mean, I get like if we talk about it here, we're going to. I mean, when we speak with
Right.
Andrew in a little bit, our guest for today. I think we're going to explore the bigger picture impact. Like, how does this take a toll on the town you live in? This unaddressed issue. If the money's not being spent on the solution, then it's being spent on the side effects. It's being spent
Absolutely.
on the consequences of not treating it. And I'm sure that when we talk with Andrew, we're going to get into that big picture thing. But as just a regular family member or individual, how do you wrap your head around that? Or if you're a program, when it's not about your bottom line, right? It's the community that you're in. It's the national. What are you going to do to address that part of it? And I'm curious to hear Andrew's take. Considering all the different angles that he has and all the different stuff that he hears.
Right. Yeah. His viewpoint, I heard him speak at a conference, is so important because it gives you that the people that say they don't care, they
Hmm.
can it at least gives you access to them, because even if they don't think they have anybody in their family that this affects or it doesn't affect them,
Hmm.
it affects the economy in general. So we all need to care about this.
Well, the amount of money, I think that they're throwing around a pretty large number that is almost impossible to wrap my head around. And I think as Andrew might break it down for us in a little bit, it's just astronomical.
Right. And
Yeah.
growing every year
Yeah.
and getting worse every year.
Absolutely. I think I'm curious to get to our guest here, Andrew. So Andrew Burki is the founder of Life of Purpose Treatment Center. He's also the director of public policy for Cityline Behavioral Healthcare Group. He is a board member for Young People in Recovery. He's on the Florida Sober Home Task Force. Man, he does everything, huh?
He really does.
Yeah. He's also a person in recovery that he identifies as such, which is amazing. And I'm really interested to hear what he has to say.
I was at a conference and I heard Andrew speak for the first time, and I was just completely blown away because he just has that out of the box thinking, talking about things that like I knew, I just didn't know how to correctly explain what I knew must be happening with all the facts and figures. And he's really able to do that. So I'm really happy to have him on today.
I'm excited.
I'd like to welcome Andrew Burki.
So my understanding is that you've got a lot of different avenues where you're seeing this impact. I mean, you're involved in a lot of different platforms out there that give you access to this information, and you're seeing it from all angles, correct?
Yeah. So, and one of the things that I've really gotten involved in is public policy. So I'm the founder of Life of Purpose. I'm the director of public policy for Cityline Behavioral Health, but I'm very involved in legislative efforts through Young People in Recovery, my board position in Young People in Recovery, and even at the local level, I'm on the board of the Bridgeway School in Philadelphia, which is Philadelphia's recovery high school.
Okay.
And when you're looking at sort of the larger systemic issues surrounding substance use disorder and really just brain diseases in general, because it's very difficult to talk about substance use disorder without talking about co-occurring mental health concerns.
Of course.
The systemic issues are so massive that it's really beyond the scope of what any individual family has the capacity to address. But it's even beyond the scope of what cities and states have the capacity to address at this point.
Mm-hmm. Oh, absolutely. It's hitting us from every angle is what I see. It's just coming at us from all over the place. Gone are the days of just trying to focus all our money on getting them well. We've had recent guests talking about the impact on the unborn children. Everything. The long-term care, the impact on the family. How I believe it was for every one person, 10 people are touched by this now. It's very widespread.
No, absolutely. And that's how we need to start having this conversation. And that's how we need to start thinking about this conversation. And that's really how we need to structure our legislation. Mm-hmm. So when we talk about how we're going to address substance use disorder as a public health crisis, we have a tendency to use extremely siloed thinking and talk about the need for prevention, the need mm-hmm. for harm reduction, the need for equitable access to treatment, which is in my specific area is probably the biggest problem that we face is access to care. The United States has the best treatment in the world. People come from all over the world to go to treatment here, so we actually don't have a problem with quality of care as much as a problem with equitable access to high quality care. And so, if you ask for help, we have no help for you, right, as a society. But if we catch you, we've got services immediately. Here's some handcuffs, we got a car for you. Yeah. Nobody's ever had to hit up grandma to help pay for a 20-year prison stint. We're happy to spend $75K per year per person, $1.5 million over a 20-year period of time, punishing someone with a treatable health condition. But Maureen has to hold a bake sale to help them find recovery housing, which is, ridiculous. It's an insane way to deal with a public health crisis.
I think that it's so important what you're saying, because people will sometimes tell me, I don't care about this issue. It doesn't have anything to do with me or my family. And I don't want to donate to it. I don't want to hear about it. I just want it to go away, and I don't want to. This has nothing to do with me. But if you listen to you for 10 minutes, you realize that it has something to do with people, regardless of whether they like it or not, because they're paying for it in some way.
Oh, sure. Well, and it affects everything. It is one of the most significant problems that we have globally, but especially within the United States, in terms of just the endless drain on resources that, we're in the 106th year of the drug war since the passage of the Harrison Narcotics Tax Act in 1914, right? So, we literally started the drug war the same year that we started World War I, and spoiler alert, we're still losing. Look at, the economic impact is staggering, right? So GDP of the United States, the wealthiest country on earth, is about $20 trillion a year, give or take a little bit. And the economic impact is now over 1.45 trillion. If you look at some of the recent, that $1,450 billion, it's just so much money. People have a hard time wrapping their heads around it. And that's just alcohol and drugs. That doesn't even factor in, tobacco, which is definitely an addiction, despite the fact that we don't like to talk about it.
Right.
And it doesn't factor in mental health concerns, right? So, we like to look at these problems and we're like, there's 72,000 people per year dying from opioids, but that's the tip of the iceberg, right? You've got 88,000 people dying from alcohol. You have 480,000 people dying from tobacco-related illnesses. When we talk about gun violence, for example, right, is really big right now. And, of the 38,000 gun violence deaths, 21,000 of those deaths are self-inflicted gunshot wounds, death by suicide. So that is just a great mental health concern. And really, the vast majority of the rest of them are inability to emotionally regulate. I'm drunk, I think my wife's cheating on me, I shoot her. Or, obviously school shootings are a major mental health concern. Whenever that, and every time that happens, we're like, we go and we interview everyone. We're like, what happened? How did this happen? Right. And it's always like we ignored this communist Chinese rally worth of red flags for 5 years leading up to, whatever horrific event is tearing, society apart. And those 21,000 self-inflicted gunshot wounds, that's not even half of the 45,000 suicides that occur per year. We don't really like to talk about the smaller ones. We don't even have, CDC doesn't even have good data for tracking. Is it, 10,000 or 15,000 people that are dying from eating disorders and things along those that are mental health concerns as well. And so, when you add all of this up, right, it's not 72,000 people dying from drug overdose, which is really fueled by predominantly opioids right now. It's 750,000 Americans per year dying from brain diseases, and we don't do this with any other public health crisis, right? We would never talk about left lung and right lung disease, right? We just talk about lung disease. We don't talk about left ventricle heart disease. We're like, this is how many people are dying from heart disease. Both of those are actually significantly impacted by substance use disorders. And so, you start adding all of that up, and the numbers are just staggering. And that's on the death side. You look at the economic impact side, right? It becomes so difficult, where you draw the line on it, right? Because someone overdoses. Our whole foster care system is completely being overrun right now with orphans because of substance use disorder related deaths. We have, the number of fires, there's 40,000 vehicular deaths per year, a large and underreported number of which are us. They talk about sexual assault on college campuses, right? The overwhelming majority of those are involve, at the very least, substance misuse, if not a full-blown substance use disorder by both the victim and the perpetrator, right? So it just starts racking up unbelievable. And it's bigger than just the industrial prison complex is a really easy target, but it does, to Maureen's point, it affects everything. It's such a staggering number. It's why aren't we able to cure cancer? Well, because we have a, $1.45 trillion economic impact from substance use disorder. You have a 10% reduction in that. If we were able to roll an extra $145 billion into cancer treatment a year and cancer research per year, we'd have cancer cured within 5 years.
Right.
So it does that, to your point, Maureen, it affects everyone.
Right. So if you don't have an ounce of empathy, you can at least feel it in your pocketbook. And that's
totally. If you don't care about us at all, and I should specify, I'm a person in long-term recovery, long-term abstinence-based recovery for over 17 years now. And if you literally don't care about us as human beings at all, it's not just the next right thing to do from a moral standpoint. Addressing the substance use disorder and mental health concern crisis in this country is also the fiscally conservative thing to do.
Yep, love it. I wish that message would get out, because then it removes the excuse of people not doing anything.
Well, and that's the whole point too. Exactly like what you're talking about, going back to this sort of what's the best way to approach this? Should we approach this from a prevention standpoint? Should we, put more money into DARE, right? Because, drugs are really expensive. Great program right there. But, should we approach it from that? Should we approach it from a criminal justice reform standpoint? Should we approach it from harm reduction with, overdose prevention sites and needle exchanges and things along those lines? Should we approach it by putting more money into treatment? Should we approach it by putting more money into recovery housing? Should we try to close parity gap? And the point is we need it all, right? And at $1.45 trillion per year, getting all of it would still be cheap.
Yep. No question. No question. I mean, everything that you're talking about. Those are all the actual symptoms of the illness. Like if you think about it, countrywide, those are all the symptoms. And all we're doing is we're treating the symptoms one at a time, just banging them out, and it's costing a fortune. As to Maureen's point,
it's an astronomical.
Yeah.
I mean, it's more than, like, we lose, our economic impact exceeds the GDP of the overwhelming majority of quote unquote first world, developed world, Western European nations.
Yeah.
Like, their whole GDP is less than we lose by just not properly addressing this issue.
And it gets worse every year.
And it gets worse every year, absolutely. And then we sell it, like, if we slow down how the speed at which it is getting worse, we're like ready to throw a parade, right? We're like, oh my gosh, we lost 72,000 people last year, and like, we're not going to lose 100,000 this year. Yay! Like, good job, America. And it's like, are you joking? I mean, that is not. If we had 70, right, like exotic birds dying, I mean, we would figure out how to solve the problem.
Absolutely right.
Well, they'd be listed as endangered.
1,000 Americans is a big deal.
Yeah, they'd be listed as endangered, and we'd be doing something to address it. Right.
Absolutely. And this is the whole thing. And this is like, you guys have been doing a pretty good job up there, in like New England and stuff with
raising a lot of noise,
Matt and things along those lines. But I mean, it's just like the scale of the problem. I mean, it should be the front page news every single day, single day. And like I said, I mean, it is really limiting our growth and development as a nation. I mean, it's so much. It's like 1 year, if you got a 50% reduction in the economic impact of substance use disorder. I mean, that's everything. It's like 1 year we could build a space elevator, and like the next year we could build, desalinization plants along the entire north coast of Africa and start reclaiming the Sahara to address climate change. It's just like, it's such a big number that you could really, really do stuff that shifts like the global landscape for, any reduction at all in, I mean, like a 1% reduction in the economic impact of substance use disorder is 3 times the cost of the expensive side of the cost of like the wall that we've been squabbling over for 2 years.
Yeah. No, I get it. I actually get, I mean, I see the war on drugs that you referred to earlier on in the podcast here was, this battle that we've been fighting that gives us the illusion that we're making progress. The idea that we're winning somehow, or that we're going to stop the drugs that are being put into the country. United States is the number one consumer of substances in the world. When they make drugs in other countries, they're like, boy, America's going to love this stuff. You know what I mean? And,
sure.
And I watched.
And we do.
We do. They're right. Yeah. We're going to love this stuff. And I watched them, the stuff that is making the front page, the stuff that is being discussed is that the war is still going and we're winning. We're seizing large amounts at the border, and the post comes out and it's on the news and we're like, yeah, people are posing around it like we're winning. Like, that's something that's actually addressing the issue, is if we could stop the supply, that the demand would diminish. And that's just such an archaic approach, is that if we stop it from coming in, people will stop using it,
I mean, to that point, this is something that they've been saying for decades. And I mean, this is not like a progressive view. I mean, our conservative economists like Milton Friedman, right? Said decades ago that, demand reduction is 7 times as cost effective as supply reduction, which is why when we've been running around burning cocaine fields in Colombia, for literally decades, it hasn't really even impacted the cost of cocaine in this country. Right. And you even have other stuff too. Like, I mean, we're talking about, how drugs coming into the country. I mean, one of the largest, most powerful drug cartels they're up there with you guys in New England.
I know.
Right? I mean, American Big Opioid is a drug cartel that has successfully made pharmaceutical grade heroin legal. And the problem is you can't say stuff like that without without it turning into this whole thing. And I mean, there's like, there is a very legitimate use for opioids in even for people in recovery, right? I mean, if I get hit by a truck and shatter my spine, they're probably going to need to use some opioids.
You would hope. You would hope, right? Yeah.
I would hope.
I would prefer. Yeah, prefer.
And that's the whole problem, is because we need to get to a point where we can say being pro recovery, being pro access to treatment, being pro prevention, being pro harm reduction does not mean that you're anti something else.
Right.
I mean, they do a very good job of like keeping us squabbling with each other.
Right.
And
they prefer
like the chronic pain advocates and the recovery advocates and the gun violence advocates and all of these different advocates should be on the same page. Like we're on the same side, right? It is the public that's losing, not these large corporations.
Right.
Yeah, absolutely. Try to keep the attention on one thing so that we don't really pay attention to what's important.
Sure.
And
the other thing, and I mean, this is like some of the stuff that like Maureen's doing up there with the recovery homes. It is really, really frustrating that we are not able to clearly state that recovery is actually pretty cheap, right? It's relapse that's expensive. It's reoccurrence use, to use the preferred term now, that's expensive. And that's the place that we need to get to, because we just have these systems that are so ineffective, right? So like we'll treat someone in an emergency room, right? But then like we don't do warm handoff. We try, even when we have good warm handoff programs, there's not resources to connect them with downstream. Our whole insurance model for paying for behavioral health care is very problematic, right? It's like, don't leave till the miracle happens. We checked your insurance benefits. It's going to be exactly 17 days and 12 hours from now.
That's when the miracle's going to happen. Yeah. Good luck.
And that's a real problem, for families, because what you end up having is families that are having to cobble together and fill in all these gaps along a true continuum of care. And we know how effective true continuums of care. All you have to do is look at how doctors treat themselves, right? Doctors get a 5-year-long continuum of care. They get them, impaired, and it's not even just them, it's everyone. Judges, lawyers, pilots, nurses, basically anyone with a trade association behind them has a continuum of care that is 5 years long. It's very effective. They recover at unbelievably high success rates. 85, 90% true success rates. And then, when you're talking about when you're talking about adolescents and emerging adults, we don't have these impaired professional equivalents. And that's why you have people, cobbling together recovery high schools and, collegiate. That's what we're doing with Life of Purpose.
Right.
We're trying to provide treatment and then connect the people to the collegiate recovery programs on the back end of those services, because the collegiate recovery programs are free if you hold student status at almost every single college that has them. And that's how you get a 5-year-long impaired professionals program for a non-professional emerging adult. Same thing with recovery high schools with adolescents, Maureen. Which you're very familiar with, if you want to talk about it.
No, we know the thing that amazes me is we know what to do. We're just not doing it. And the cost of not doing the everything the easy and the simple and the straightforward way that we know that works, because like you said, it works with professionals. So the people that we think are important enough to get this care, yet we don't have the same level of importance to our children. Right. I don't understand that. So, but you're right. We can keep doing it this way and doing it over and over again, losing people and continuing to spend the ridiculous amount of money that we're spending, or we can change the way we're doing things. And I don't know you for a very long time, but my guess is you have some ideas on how to change things too.
Sure. Yeah. So two of the legislative proposals that we've been working on for a while. One is really trying to shift the smaller one, although it's still big, is trying to shift the way that insurance reimbursement works. So one of the things that's really problematic if you look at the treatment industry as a whole, and one of the things that really, enables treatment centers to commit fraud and perpetuates all the client brokering and all of the things that have occurred, is this fee-for-service model, right? So you get paid the most money as a provider for providing the highest level of care. And providers actually have to make a conscious, ethical decision to connect people with good, lower level, subacute level of care resources to produce the best outcomes. And so one of the proposals that, I've been pushing for a while, we actually, through some of the recovery advocacy organizations, like Facing Addiction, that I have a bunch of buddies over at, we actually got this in the ask to the president a while ago through Office of National Drug Control Policy. Wow. Is to shift to a values-based care system so that we're paying for wellness instead of paying for sickness. And the easiest way to do that is you just pay 50% of the reimbursable rate at every single level of care. And then if there's no acute care episodes for 12 months, because the overwhelming majority of reoccurrence of use happens in the first 12 months, then the insurance provider would pay an additional 100% for a total of 150% of the reimbursable rate. But if there is, you just push the whole loss onto the treatment center so that it's not, because under the current system, we're really pushing the loss onto families.
Right.
Because families do not have they're separated, right? So even though we think of like the families of people with substance use disorders as a very large group, there's not a tremendous amount of family advocacy going on. Although there are people trying to change that, and there's also they don't have lobbyists, right? If you're like a large insurance payer,
Yep.
You've got lobbyists in DC going and talking to senators, and then family groups are like, it's usually like a couple, pretty rowdy moms that are going in there and like trying to get this stuff done. And then the other problem, and this really gets to stigma. The other problem is because of how stigmatized substance use disorder is, a lot of the times the parents that are representing families as a whole are typically families of loss,
Absolutely.
right? Because a lot of families whose kid is successful, they've got stigma on the one side because their child has a substance use disorder, and then there's a little bit of stigma on the back end too, because you feel terrible about it that your kid made it and some other mom who loved their kid just as much as you love your kid didn't make it. Right. So you're kind of like, well, I can't get in there and talk about that. I got to, kind of give the mic to the family that had to bury their child, which I think is a pretty reasonable and human, way to look at it. But we need to be talking about, what families had, because that's the only reason I made it, right? The only reason I made it is because I had a super, super gritty mom that was just like, all right, well, you're going to get better or you're going to die trying. Like, these are the only two possible outcomes, and I got lucky, right? Over an extended period of time, but I had a year, I relapsed, I had 9 months, I relapsed, I went to jail. Mm-hmm. She's like, I'll get you out to send you to rehab. I was like, I'm not going back to rehab. I've been to rehab. It doesn't work. And then she was like, well, then I guess you're going to have a good time in jail because I feel like you're less likely to overdose. Yeah. And then after 4 months of that standoff, I was like, what sounds really good, Mom? Rehab.
Yeah, she wasn't wrong. She wasn't wrong. You did have a less likely chance of overdose in jail, and it was a safer place, I'm sure.
But that's what's so difficult about the entire thing, because it's like we don't have good systems for supporting particularly young people over a very long period of time. We just don't have it. Parents are sort of like, it's like, good luck, figure it out. My wife and I are both therapists. And we have a 3-year-old, and like when we had when we had him, they weren't like, here's a manual in case he develops substance use disorder 15 years from now.
Yeah, page 97. Page
Page
97. Just,
97.
yeah.
Check it out.
You brought up a point earlier, and I think we've just been discussing it all along, and it's going to come up repeatedly. Is that we could absolutely have the conversation about what is it going to take to get somebody well, right? I mean that it's a common sense question. If we just sit down and two or three fairly intelligent people get together with a piece of scratch paper or on the back of an envelope and just say what would it take for somebody who's going through this to get well, we could come up with the answer. Right. The question is, how do you get insurance companies to want to pay for this? And you brought up a point. I remember testifying at the Heroin and OxyContin Commission, and I can't remember the senator that put it together up here in Massachusetts. But I went and I testified, and the day that I was testifying, it was full of insurance company lobbyists, and they were in there testifying about why they reimburse the way that they reimburse, why 3 to 5 days, why 7 days, and then why is it so much more cost effective, and why does it make sense for them to then refer into outpatient instead of covering the actual length of stay that's required. And I'm sure my testimony fell on deaf ears because I was complaining about why insurance wouldn't pay. But my argument was very similar to yours earlier, is that I brought up the impaired professionals. If I was a physician and my license was on the line, you would demand that I got a certain level of care because that's what it takes to get me well. However, I'm not. I'm just a normal, 20-something opiate addict, and instead you're telling me that I should be fine with a subpar level of care, almost as though I don't need the same thing. I have a similar problem, but because you can't you can't lord my license over me, or you think that maybe I deserve less. And I was just so thoroughly confused early in recovery, advocating, screaming at the State House in Boston, trying to create change. But I feel like the insurance companies had their minds made up that they're looking at this as what's more cost effective. And I love your point earlier that saving money in the long run of we'll pay half, but if you can't provide results, we're probably going to stop doing that. I love that.
Right. Well, or even if you look at it over if you look at it as a chronic disease, right, that may require more than one treatment episode to be successful, which it oftentimes does. And one of the things you really have to look at when you're talking about the treatment of substance use disorder is first of all, like, what are we treating? Right. And the reality is we're treating the human brain, and saying that, the human brain is more complex than other organs is like saying that, candles and the sun both produce light. Right. It is unbelievably difficult to treat human brains. So, you've got a couple problems that stem from that as a result. Right. So the first one is we do a terrible job of screening for substance use disorder in this country. So we don't catch substance use disorder at stage 1 and stage 2 the way that we do with cancer. By the time we're even having a conversation about whether someone is willing to accept help, it's at stage 4. Right? You're completely unbearable. You're unbearable for the people around you. You just wrapped a car around a tree. You literally died, and then were resurrected with life-saving medication like naloxone.
Right.
And then it's like, hey, you just died. Maybe now are you willing to accept help? I mean, that's crazy.
Well,
right?
That's the denial. Everyone's in such denial that it's a problem that it takes something like that to often shock the family into saying, hey, let's do something about this. Or the person to be like, hey, maybe because I did just die and had to be resurrected, maybe I have a problem. Because everything up to that is just shrouded in denial and confusion. Like, that's the screening process. Like, how do you clarify that, right?
Totally.
How do you fight through
that's
that?
that's how all my recovery episodes started. One started with an overdose in an emergency room, and the other 2 started with handcuffs.
Absolutely. That's how mine were, yeah.
It's only active opioid use disorder.
Yeah.
And that's something we have to do too, right? We need to parcel out, frontline law enforcement that we desperately need to be, carrying, Narcan or naloxone,
Right.
and we need to separate that out from 40 years in prison. Like, long-term incarceration and frontline first responders are fundamentally different things, even though they get lumped together. But, back to this insurance reimbursement model, that's, if you look at paying 50% of the reimbursable rate, and then if you have to restart pushing that loss onto the treatment center, it does a couple things really quick. First of all, it cuts out entire continuums of care, right, for the cost of entire continuums of care if you have multiple unsuccessful episodes. So let's say someone has to go to treatment 10 times, right? If you're only paying, 0.5 for the first 9 failed episodes, and then 1.5, 150% for the final successful episode, then you're paying 6 treatment episodes instead of 10. So it literally cuts 4 full treatment episodes off the life cycle of that person going into treatment centers and detoxes and lower level of care stuff. Second of all, it allows the insurance payer to collect interest on the float for 2/3 of a successful treatment outcome for an entire year, because you're deferring payment for a year, and you multiply that times hundreds of thousands of cases. That creates like very significant resources, which allows them to lower deductibles and out-of-pocket maxes for families, which increases access to care, which allows them to provide better services. And even for people that get it relatively quickly, if you go to treatment 2 times, it's break even, right? 50% for the first unsuccessful episode, and then 150% for the successful second episode. But what it does is for the treatment center, it creates a monetary incentive for them to do a good job. Because if you're not producing at least a 50% success rate, you are now going out of business. This is the only industry that people would ever get away with having the failure rates that some of these places have, right? If you guys were building buildings in downtown Boston and 90% of them collapsed, and you're like, oh, I guess it didn't want to stay up, everyone would go to
it would be weird if I expected to stay in business after that. That would be a strange expectation for me to have.
Yeah, no, it's totally crazy. You can't say that you can't classify it as a disease on the front end while you're authorizing insurance, and then take no responsibility for the individual or their family on the back end. And that happens all the time still. And it's not just, hardline, old school guys that are saying that. I've heard, master's level clinicians say, I guess they weren't ready, right? Which is crazy, right? You would get punched in the face if you said that for cancer, right? If you were like, hey buddy, this is the 3rd time your wife's cancer come out of remission. When are you just gonna let her go? You would immediately get punched. Right away, punched in the face,
and hopefully fired.
Totally. And so that's one solution. The other thing, the other even larger proposal that we have is that we've proposed is legislating tax credits, right? And transferable tax credits. We have them in agriculture. We have them in entertainment. You want to film a movie in Atlanta, you get $20 million tax credit. You don't have a business in Atlanta, so you sell it to Coca-Cola. Federal tax credits are trading for 94 cents on the dollar right now, something like that. So what you do is you legislatively structure them to fill in all the gaps, right? And you do it for everything. And so it lets you do a couple things. One, it lets you price fix how much treatment is it, because we have this tremendous variance in cost of care, right? Maybe it's $30,000, maybe it's $70,000, maybe it's a $500 deductible. That's a pretty broad range.
Yeah.
So it lets you price fix. You, in conjunction with insurance, it then takes pressure off of insurance payers. Because look, this is the way you deal with a public health crisis, right? The way you deal with a public health crisis is you raise taxes, and then you have money to pay for services. But we're never going to do that because we hate taxes more than we hate poor people dying in this country, which is an entirely separate podcast and another problem that someone else can deal with. So for substance use disorder, the way you do it is you structure it as tax credits, right? And then you can cover all of these sort of lower level of care services, right? You can pay for recovery high schools, you can pay for collegiate recovery. Cities could do it. Boston could do it with the recovery houses. If they were, if they issued a, $400 a month tax credit to subsidize recovery housing as a city, right? That would immediately create access to recovery housing, because it would, I have no idea what recovery houses cost up there, but let's say it's $900 a month or something like that Dropping from $900 a month down to $500 a month creates a situation where unskilled emerging adults with minimum wage jobs are now able to pay for their housing and support themselves. Because like I had to be subsidized with my recovery housing. I mean, I was like Florida. I made $5.25 an hour plus tips, which were entirely in quarters.
Can't survive on that.
Back through the ghetto with my car pants full of quarters every night. There's no way I could have paid for my recovery house without my parents, subsidizing. I mean, I could contributed 100% of my earnings and still would have fallen short.
Absolutely.
Wow, that's something, huh? I mean, he is just amazing.
He touched on everything.
I
mean,
know.
I feel like at the end, I just wanted to keep going.
I know.
I had so much more to talk about.
Right. And he's got answers too, which is, there's nothing worse than somebody that just has lots of complaints. I mean, I could complain all day, but I don't know how to fix those particular things.
Right.
But he's got, I mean, it may not be the whole answer, but he's got at least a start and a place that we can begin to solve these problems.
Well, I mean, they all sound like, I keep tapping away at the big picture on this, and I think we're always going to come back to what can the next person do, and I hope we get to talk about those with him as well. But the initial conversation of just starting the conversation, almost like opening it up just to see what the problem is. Yeah, we don't want to complain about it, but we need to clearly identify it, right? Like I think we said last time we were talking with Diana, it was, if we can clearly identify a problem, the solution is in the explanation of the problem. As we start to talk about what's broken. And so I think he did a great job of helping us do that. And
he answers when people say it's got nothing to do with me, he answers that question because it most certainly does.
Yeah.
Yeah.
No, it's true. That's true. I mean, who doesn't feel that way? It's not my problem. You know what I mean? I don't have that issue. It's not in my family. It's not in my neighborhood. It'll
never happen to me.
It'll never happen to me. And even if it doesn't impact me. The whole economic impact is it's hitting everybody's wallet. Everybody's pocketbook is being affected. Right. And it's not just the people who have to like we were saying in the beginning, dealing with the stealing and the theft and all the money spent on treatment. It's you don't even realize that it's taking a toll on your community.
You're paying for it eventually.
You know what? One way or another.
Right. We're losing this many people, too. You're going to see the impact, I think, in the economy for years and years to come in just workforce.
Mm-hmm. No, I agree.
Yeah. So, I mean, it's always that idea where people think that it doesn't affect them. And if it doesn't affect them, they don't have to do anything about it. And that's kind of the reason that I wrote the book that I wrote.
Yeah.
Because in the beginning, when I was approached first to write the book, I thought, well, I want to write it so that other people can understand what I'm going through, that are also going through it, so they don't feel alone. I mean, the reason I created Magnolia New Beginnings, it was the same idea was behind the book. And then
you say the book. This is If You Love Me, A Mother's Journey Through Her Daughter's Opioid Addiction.
I just happen to have a copy of it, right?
There it is. I knew the book had a name.
It's If You Love Me, A Mother's Journey Through Her Daughter's Opioid Addiction. And it's published by Macmillan and Henry Holt. But when I first started to write it, that's what I thought. But then as I began to write it and talk to people about what I was doing, I realized, you know what? I'm really writing this for people that don't think it can happen to them, who think that whatever they're doing is so special and unique that even if a person has a disease and they're born with it, or they have trauma in their life and they lean towards an unhealthy way of coping with it, or whatever the reason is that somebody starts, that, these people that think that it can't happen in their life, they will see that I didn't think it could happen in my life too. I thought I was on top of everything, and it did, and I was not. I'm so ordinary. I'm an ordinary person. I had an ordinary.
Well, you're far from ordinary, but I get what you're saying.
Yeah, but I mean, I'm just like everybody else, going to work, taking care of their family, loving their children, going to, church and having Sunday dinner and taking them to, I used to run between softball and baseball. And I mean, but that was, that was my life, and it still happened to me. And I know lots of people that love their children deeply and put them before themselves at every turn and do all the things that good parents are supposed to do. And it still happened to them.
Yeah.
So, I mean, it's, it's one of those things.
Well, and
like,
you put the word journey in the title of your book. I mean, it is a journey. You don't know where it's going to go. You know, you weren't in charge of it. You were just there for the ride for most of it. And telling a story and talking about how it can be overcome, how you can get to the other side of it, and not even just getting to the other side of it, but surviving it. Both sides.
Yeah, definitely. Yeah, because I still feel, it's ongoing. I don't know what's going to happen. I thank God every minute of that I'm awake, that my daughter's still with me, but and doing wonderfully, thank God. But people read this book and they think they're waiting for her to die. And people that haven't read the book, and when I speak, which I do a lot, there's always people that don't know, the after story, and they're just, they'll come up and say, "I'm so sorry for your loss," and I'm like, "No, she won."
Yeah.
Or she's winning anyhow.
Yeah.
She won, and I feel like she definitely. You know what? Regardless of what would ever happen, she won this because she's now had almost 2 years of being this incredible person she always was. She got to be that person again. And, and I hope it continues forever, but I couldn't be more proud of her than if she graduated from Harvard. And the story is very, very, I want to say
it's
ordinary
powerful
because it's happening all over to lots and lots of people. And I hope that people that don't understand, the same people that say, this doesn't affect me. It doesn't, I don't have anybody. I wouldn't, matter of fact, if I had somebody that I needed, that needed treatment, I wouldn't pay for it. I'm not doing those things. So it has no impact on me. They need to realize the economic impact, and they also need to realize that this can happen to anybody.
Absolutely. Of course it can. I mean, there's no, I think there are no, there's no demographic barrier. It doesn't just bump up against we don't go there. You know what I mean? We're not going to get into that.
Me.
And your book, as ordinary and everyday as you say this experience is, it's powerful to hear about how it can tear down a family system, or almost tear down a family system. And the insight that you give in there. I mean, just talking about the experience and the journey is just so powerful for a mom. I'm not a mom. I'm a dad. I'm not the father of. But I am in recovery myself. So, I mean, I can imagine how difficult it is for my mom. And in your book, I mean, that's probably the same story.
It is over. People write to me and they tell me, "You told my story, you told my story."
Yep.
And it's because we're all living a very similar story. I tried very hard, and I think I was successful in telling the story with a lot of humor. Because first of all, that's the way I got through it. I mean, my whole family has a little bit of a warped sense of humor. So we were able to always, no matter what was going on, find some kind of some way to laugh about something, but in a very unfunny situation. But so I tried to tell the story with humor, because otherwise you would want to, jump off a bridge after that. So we don't want that. I don't want to be responsible for that. No.
Well, it's a heavy topic.
It's actually a funny story. So it's told in a very funny way. And I mean, I look like a nice, calm, middle-aged or more person who probably wouldn't hit you with a baseball bat, but there's stories in there.
But as they start to read the book,
another story.
They're gonna if they haven't seen you before, they're gonna picture you as this wild woman running around with a bat looking for somebody. So, it's definitely
and that's what happens to us.
So now, how can people get access to this book? This book sounds like a great resource for people. So where is it?
Thank you. It's available everywhere. It's available on Amazon, in most bookstores. It's also available at the library. And it's one of the craziest things that happened was on Audible. I was named 2018 runner-up for Memoir of the Year, and Educated, which was a fabulous book, was #1. But the other person it was 2 other people that were named for the runners-up, and the other one was Michelle Obama. Ooh. So I got to have my book next to Michelle Obama's book.
There.
I know. I'm of all the things that have happened in the last year and a half, that's the one that blows me away the most, because I mean, seriously?
I know, right?
I kept waiting for it to be gone. Like, I kept looking at it and waiting for them to realize they made a mistake and take it down. But you get to hear this voice, this Brooklyn accent, read the book to you. So and that's available at the library too. So I don't want anybody to feel like they can't access it. You can, get it in anywhere you would buy a book, online at Amazon or in a library, and they'll order it for you if you want it.
If you just speak up, right? Just tell them you want it.
Absolutely.
Nice. Well, I mean, I think that's a sign of the times too, just how popular this topic is, how relevant this topic is, that, it kind of rises up to the top as a book that needs to be read, a topic that needs to be discussed. And, again, just so grateful for, the guest speakers that we've had up till now. Diana talking about the long-term care and the family focus, and, Andrew helping us understand some of the economic impact across the country. Again, like we said in the last podcast, this is, we're bringing people a conversation with guests that they would never be able to hear from, about topics that they may not even know to ask about. And I think that education, it's great. It's good for me. I enjoy this education as well, and I hope our listeners are enjoying it. And as we said last time, this podcast is available across the board. And if you want to find out how to listen or watch or listen to previous episodes, it's available at cdpodcast.com. Everything you need to know is on there, and I believe we may even have some links to your website so that they can get access to your book and information about the book as well.
Yes.
And this will help them gain access to our Facebook page, our Twitter page, and all the different formats so they can subscribe to our YouTube channel, watch our videos, listen to our podcast. And on our website, there is a comment form that people can use to submit comments about topics, ideas. I don't know why that sounded funny as I was saying.
All of those.
Yeah.
All of those.
I felt like as I was saying ideas, there was a little bit more of an accent to it than there really was there. But
oh, God.
Yeah, so...
You're right. So they can go to MaureenCavanaugh.net too.
Okay. Great.
If they want an easy kind of right to the book.
I like that one. I just gave them like 100 ways to do it, but direct access is the best one.
If they can't find it after that, they can call me on the phone and I will tell them that again.
Should call you directly. Exactly. I love it.
Oh, God. I'll read it to them myself.
Yeah. So I guess looking ahead, what we have is our next podcast is going to be the second half of our interview with Andrew Burki. And I believe that the second half, we're going to be getting into some of the things that individuals can do, maybe even kind of boiling it down to much more of an action-based conversation, and all the different steps that people can take as individuals, and maybe even some ideas about what communities can do. So I'm really looking forward to the second half of this conversation.
Me too.
Yeah.
Me too. I love the way his brain works.
Yeah, it's amazing. All right, I'd like to thank all of our listeners for joining us today on this episode of Collateral Damage. As always, if you'd like to find out all the different ways that you can listen to our podcast, you can visit our website, which is www.cdpodcast.com. There are many different ways to listen and subscribe, and we encourage you to choose the one that's most appropriate for you. And as always, I would encourage our listeners to get informed.
Stay connected.
Thank you for joining us.